Stomach cancer is often called the silent killer for a reason. Over 1 million people are diagnosed every year, and a staggering 80% of those cases are caught too late. These aren't just numbers, they're lives, parents, siblings, and friends, hanging in the balance. But here's the good news: you can change the outcome. Your body sends signals, subtle signs that something might be wrong. Recognizing these early warning signs can make all the difference. In this video, we'll uncover the critical symptoms of stomach cancer that could save your life. Let's get started. What is stomach cancer? Stomach cancer, also known as gastric cancer, starts in the lining of the stomach and typically develops slowly over many years. It often doesn't show symptoms in the early stages, so by the time signs appear, the cancer may have spread, making it harder to treat. Early detection is crucial. Several risk factors can increase your chances of developing stomach cancer. One of the biggest is an infection with Helicobacter pylori, a bacterium that can cause chronic inflammation in the stomach. A diet high in salty, pickled, or processed foods also contributes, as well as habits like smoking and excessive alcohol consumption. If you have a family history of stomach cancer or conditions like chronic gastritis or ulcers, your risk may be higher too. The tricky part is that early signs of stomach cancer can easily be mistaken for common issues like indigestion or stress. That's why it's important to stay vigilant and pay attention to persistent symptoms. The sooner we catch stomach cancer, the better the chances of successful treatment. So, let's dive into the key signs to watch for. Stomach pain and bloating. Stomach pain and bloating are often linked to indigestion, but if the discomfort persists regardless of diet, it could signal a more serious issue. Tumors can block the digestive tract, cause inflammation, or disrupt stomach acid balance, leading to constant pain. This isn't normal and shouldn't be ignored. Talk to your doctor about ongoing discomfort to rule out serious conditions like stomach cancer. Unexplained weight loss. Losing weight without trying can be concerning. Tumors can interfere with digestion, reducing your body's ability to absorb nutrients, leading to unintentional weight loss. This can also be caused by reduced appetite due to nausea and discomfort. If you notice significant weight loss, even with normal eating habits, seek medical attention. Blood tests and imaging can help identify the cause. Feeling full quickly. Early satiety. Let's start with one of the more subtle yet telling signs: feeling full too quickly, also known as early satiety. Imagine sitting down to enjoy a meal, but after just a few bites, you're done, not because you're satisfied, but because something feels off. You're uncomfortably full, even though you've barely eaten. This sensation can be caused by tumors or abnormal growths in the stomach, which can physically reduce the stomach's capacity, making it feel like there's no room for food. Sometimes, these growths can even block parts of the digestive tract, interfering with the normal process of emptying your stomach after meals. Over time, this can lead to nutritional deficiencies, weight loss, and other serious complications if left unchecked. It's easy to dismiss this symptom as something temporary, like stress or a change in appetite. But if this sensation persists, especially when you're maintaining your usual diet and activity level, it's important to take it seriously. The best course of action? Don't wait. Reach out to your doctor and explain what's been happening. They may recommend tests like an endoscopy or imaging to get to the bottom of the issue. Remember, your body is trying to communicate with you. Listening to it could make all the difference. Unexplained weight loss. Unexplained weight loss is another key sign to watch for. If you're losing weight without trying, especially if you've been sticking to your regular diet and exercise routine. This could be a red flag. This weight loss often occurs because the tumor or growth is disrupting the body's ability to process food and absorb nutrients properly. You might not notice it right away, but if you find yourself shedding pounds unexpectedly, even without significant changes to your lifestyle, don't ignore it. Talk to your doctor to explore the cause and rule out any serious issues. Persistent nausea and vomiting. Let's move on to another critical warning sign: persistent nausea or vomiting. While occasional nausea or vomiting can happen due to something as simple as food poisoning or a stomach bug, when it becomes chronic or persistent without a clear cause, it could indicate a problem in your digestive system. If you experience ongoing nausea or vomiting, especially if it doesn't improve or is accompanied by any other concerning symptoms, it's important to seek medical attention. Persistent nausea could be a sign that something more serious is at play, and early detection could save your life. Chronic indigestion or heartburn. Occasional indigestion is common, but when nausea lingers for days or vomiting becomes frequent without a clear cause, it's time to pay attention. Tumors in the stomach can interfere with digestion, blocking food, irritating the stomach lining, or causing other disruptions. This leads to ongoing nausea and vomiting, which can leave you weak and malnourished. While antacids might offer temporary relief, they can mask symptoms, delaying proper diagnosis. If this is happening frequently, consult your doctor for proper testing like an endoscopy or imaging. Blood in stool or vomit. Seeing blood in your stool or vomit is alarming and a clear warning sign. Tumors can bleed, and the blood may appear as bright red in vomit or dark, tarry stools. While it could be caused by less severe conditions like ulcers, it should never be ignored. If you notice blood, immediately contact your doctor for tests to identify the source and get early treatment. Anemia and fatigue. Now, let's talk about a sign that many people might chalk up to being overworked or simply tired: persistent fatigue. But this exhaustion goes beyond just needing an extra cup of coffee. It's a deep, unrelenting tiredness that affects your whole body. When stomach tumors bleed, even slightly over time, it can lead to chronic internal blood loss. This ongoing bleeding often results in anemia, a condition where your body lacks enough healthy red blood cells to carry oxygen effectively. Without sufficient oxygen, your body struggles to perform basic tasks, leaving you feeling drained and weak. You may notice that you're out of breath after climbing a flight of stairs, or that your skin appears unusually pale. Maybe you find it harder to get through the day, even after getting plenty of rest. These aren't just signs of a bad week, they could be your body's way of signaling that something more serious is going on. So, what should you do? Talk to your doctor and request a blood test to check your hemoglobin levels. This simple test can quickly identify anemia and help determine if internal bleeding might be the cause. Don't ignore persistent fatigue, it's your body's alarm system. Catching this sign early can lead to timely diagnosis and treatment, possibly preventing something much more serious. Swollen lymph nodes. Swollen lymph nodes, especially near the neck, collarbone, or stomach, can signal that stomach cancer has spread. Lymph nodes filter harmful substances, and when cancer spreads, it often affects these nodes first. If you notice lumps that don't go away or continue to grow, don't wait, consult your doctor for further evaluation, including imaging or a biopsy. Persistent heartburn or burning sensation. While occasional heartburn is common, persistent heartburn that doesn't respond to antacids could point to a more serious issue like stomach cancer. A constant burning sensation could be a sign of chronic inflammation or a tumor in the stomach lining. If heartburn continues despite treatment, See your doctor for an evaluation. These signs should not be ignored. Early detection can significantly improve treatment outcomes. If you experience any of these symptoms persistently, seek medical advice.